Hello, this is Dr. Kingston, and in this video, I am going to give you a very brief introduction to the cranial skeleton. And to do that, we are going to briefly locate and describe the bones that make up the cranium. Now, when we talk about the cranium, we very often divide the bones up into two categories. We've got bones that house the brain, or the neurocranium, and then the bones that make up the face, or the viscerocranium. These bones are going to articulate with one another at sutures, which are a type of non-mobile joint. So you can see these on the pictures here where the bones of different colors kind of butt up against each other. And if you look closely at the models in the lab, you can usually make out how they kind of interdigitate with one another as well. Now, if you look closely here, you will no doubt notice that some of the bones appear to touch both the brain and the face. And this is true, right? There has to be some overlap. So if you are wondering what the defining trait here is to tell the difference between the two, it's touching the brain. If a cranial bone is in any way touching the brain, it's considered to be part of the neurocranium. Anything else is viscerocranium. All right, we have 6 named bones that make up the neurocranium. These all start off as 2 separate but paired bones. But the ones that cross the midline tend to fuse bilaterally, okay? So the right and left bones fuse together, while the ones on the outer margins then will stay separate. So we see this kind of fusion here in the frontal bone, and that forms the superior portion of the eye orbits. Pull up my pointer here. So we've got the frontal bone making up the superior portions of the eye orbits, and then extending superiorly and posteriorly up through the forehead. All right. Posterior to that, we have 2 parietal bones. So we have one of these on each side, note here and there. And inferior to that, we have the temporal bones. Okay, the temporal bones are going to house the middle and inner ear. You can see a little passageway for that right there. And they are also going to form the articulation point with the mandible. All right, and again, we have one of those on each side. Most posteriorly and inferiorly, we have the occipital bone, which is going to articulate with the vertebral column and actually transmits the spinal cord into the cranium to meet up with the brain. The last 2 bones of the neurocranium are the sphenoid and the ethmoid, and because of where they sit, we don't often see more than a little bit of them at a time. All right, so let me pull up the sphenoid here. As you can see, it's actually quite a pretty shaped bone. It's often described as butterfly shaped. I think if you look at it from a specific angle, it looks more like a very angry owl, but we can talk about that more in lab. But it's a very complicated shape with a lot of surface area. But when we're looking at the external surface of a cranium, we only see this little bit of it here at the temples, and then we can see a little bit more of it here in the orbit. All right, the ethmoid then, this little guy down here, he's kind of like a balloon in bone form. He has very thin walls and a lot of air pockets. The ethmoid doesn't even extend all the way out to the lateral surface of the cranium. So we can see it making up a little bit of the medial wall of the orbit here, and we'll see it again inside the nasal cavity. All right, this view here is just to give you an idea of how these bones connect the inferior aspect of the cranium. There just wasn't room for this view on the last slide. So posteriorly, again, we have the occipital bone, and this gives you a great view of the foramen magnum, which is what the spinal cord passes through to meet the brain. And then we have the occipital condyles here that will articulate with the vertebral column. Purple here is the temporal bone, which looks a lot different in this view than it did from the side, right? It had a big fan shaped when we looked at it from a lateral view. And here we can see it's got this little projection here. This portion is called the petrous part of the temporal bone, and this is actually what's housing the components of the middle and inner ear. All right, and last but not least here, we've got another view of the sphenoid. So this time we are able to see the inferior surface of it, and that is shaded in yellow here. I want you to notice that it has a number of little foramina, or holes, that poke through it. And I want to draw your attention to these just to notice that they're here. We're going to be learning about these in a little bit more detail in some future sessions this week. So I'm just going to leave it at pointing them out, but this is where they come out on the base of the skull. All right, the viscerocranium then is the rest of the cranial bones that make up the facial skeleton. The lower part of the face is dominated by the oral cavity. So we have the two bones responsible for making up most of its walls. We've got the mandible here most inferiorly, and that has the inferior tooth row. It's the only cranial bone that has a purely synovial articulation. So synovial joint is a mobile joint that has a specific type of membrane and articular capsule that allows it to move. And that is what allows you to open and close your mouth, is this synovial joint here between the mandibular condyle and the temporal bone. The maxilla sits superior to this, and it has the upper tooth row. So together, these two create most of the boundaries of the oral cavity, okay? The maxilla is going to project further superiorly as well, and it ends up making up most of the middle aspect of the cheeks here, as well as part of the nasal aperture and the nasal cavity on the inside. The lateral cheeks are formed by the zygomatic bone, which will articulate posteriorly here with the temporal bone. So it forms this nice little bony arch that goes over the top of some muscles of mastication or chewing muscles that attach down onto the mandible. The lacrimal bone is this tiny little thing here you will notice on the medial wall of the orbit. Most of its surface, as you can tell here, is made up of this little hole. And this is going to transmit the nasolacrimal duct. So the lacrimal bone takes its name from lacrima, which means tears. And it is called this because it transmits this nasolacrimal duct from the eye orbit down into the nasal cavity. So the tears that are produced in the orbit are then shed down into the nasal cavity. All right, and last but not least here, we've got the nasal bones, which are going to form the superior part of the nasal aperture, kind of the bridge of the nose area. All right, now you can see in this picture here that there are a number of bones sitting deeper in the nasal cavity that we don't have a clear view of yet. So I'm going to pull up a different view again. All right, and I'm going to have you look over here to the inset on the right. And what this is showing is the medial wall of the nasal cavity, also called the nasal septum. So this is what separates the right and left sides of the cavity, or the right and left cavities. You can see the bony portion of this in green here. So it has bony portion posteriorly. This is called the vomer. It's a triangular shaped bone. And the other bony part of this we already touched on a little bit is a part of the ethmoid bone. Okay. And then the anterior portion is just cartilage, which is why you're able to move this if you grab the end of your nose. All right, the vomer is also visible just a little bit if you look at the base of the skull. And what you're actually seeing here is this portion of it. I know it's a little bit tricky. It's a little bit of an optical illusion, but you can see that coming up to articulate with the sphenoid here. The other bone that we can see from this view here, part of the viscerocranium, is the palatine bone. The palatine bone is going to form the posterior portion of the hard palate. Hard palate is mostly formed by the maxilla, so that's extending between the teeth at that upper tooth row here. And then this posterior part is an entirely separate bone. All right, you have survived the info dump portion of this. So now let's ask a question just to put some of this together. Which bone forming part of the eye orbit is considered part of the viscerocranium? And the correct answer is the zygomatic. Now, remember I said that the main defining feature of a neurocranial bone is that it touches the brain. The ethmoid, the frontal bone, and the sphenoid bone all have portions that touch the brain. The zygomatic is the only one of these that is entirely out on the face, making it that lateral portion of the cheeks. And that is going to bring us to the end. Thank you very much for joining me.